Hi guys, let's start with the question of the day. So the question goes like, and it is from a very important topic. You will get at least 2 to 3 questions from vitamins. So please do it very nicely. So the question is, a 13-year-old girl with history of cystic fibrosis presents with weakness. She has been in foster care with unstable housing situation and has been non-compliant with her medication regimen. Vitals are normal. Physical examination shows ataxia, decreased vibratory sensation in lower extremity and pale conjunctiva. Labs are significant for normocytic anemia with elevated reticulocyte count. Blood smear is negative for megaloblastic or hypersegmented neutrophils. What is the likely diagnosis? So, options are vitamin B12 deficiency, vitamin E deficiency, vitamin A, or vitamin K deficiency. So, long question. Let's try to read from the last line. Blood smear negative for megaloblastic segments or hypersegmented neutrophils. Significant for normocytic anemia with elevated reticulocyte counts. It's showing ataxia, cystic, decreased vibratory sensation in lower extremities and pale conjunctiva. And history of cystic fibrosis. So for history of cystic fibrosis, first what cystic fibrosis teaches us, that cystic fibrosis there is chloride channel defect, and second there which chromosome is affected, chromosome number 7 is affected in cystic fibrosis. What is the loss of fat soluble, which fat soluble vitamins are lost here, that is KEDA. We have to learn that not water soluble vitamins are lost here, fat soluble vitamins are lost in cystic fibrosis. I learned it by mnemonic KEDA, vitamin K, E, D and A. First, let's try to understand what is vitamin B12 deficiency. I will not teach everything about folate trap. I will just explain about the keywords. What is B12 deficiency? We all know in B12 deficiency, that is megaloblastic anemia, there is macrocytic anemia and macrocytic megaloblastic anemia. What happens in macrocytic? That is the MCV is increasing and there is hypersegmented neutrophils. What happens in hypersegmented neutrophils? There are more than 5 to 6 lobes in a hypersegmented neutrophil. Which tracts are affected? We have SACD, subacute combined degeneration. So which tracts are affected? We have spinocerebral tracts. Spinocerebral means some ataxia will be there. Lateral corticospinal tracts. C so you can learn lateral corticospinal tracts, and from D you can learn dorsal columns. Dorsal columns we have touch and proprioception, and lateral corticospinal tracts it carries the pain and the temperature sensation. So in vitamin B12 deficiency these tracts are affected, and there's increased levels of homocysteine and MMA, that is methyl malonic acid. I will teach this in a separate topic. So this all happens in vitamin D12 deficiency. So yes, answer can be vitamin D12 deficiency, but why it is not the answer? Because it is negative for megaloblastic segments or hypersegmented neutrophils, and the labs is showing normocytic anemia. So answer cannot be A. So now what options are there? Vitamin E, A and K. So what happens in vitamin K deficiency? You all know that vitamin K, it is a fat soluble vitamin which is responsible for gamma carboxylation of glutamic acid residues. Very important, again a PYQ, already been discussed in another video. Which clotting factors are affected? Factor, I learned it by mnemonic 1972, factor 10, factor 9, factor 7, factor 2, and protein C and S. This many people don't remember this. Protein C and S are also affected. Warfarin inhibits these clotting factors. Now I want you to know, tell me in the comment box which factor is the first to be lost in vitamin K deficiency. Now what happens in vitamin A deficiency? Vitamin A, what is the earliest manifestation? Most of you will answer night blindness. No, the answer is decreased sensitivity to green light. So this can be a very potential question. What is the most specific marker? Specific marker here is Bitrot spot, and Bitrot spot, it is a reversible condition. The most important, it is one of the most important epidemiological marker. This you have to just ratta, you have to learn this. What are Bitrot spots? What are the in epidemiological markers? It should be less than 0.5% in school going children, and night blindness, it should be less than 1% in school going children. In vitamin A deficiency, what is XN? It means night, N so you can learn night blindness. From 1A, conjunctiva. The conjunctiva is affected. There is cirrhosis. Cirrhosis means drying. 1B. From B, you can learn white rod spot. 2, only I learn like 2 is alone. Nothing. 2 is just 2. There is 2 words. Corneal cirrhosis is there. The cornea is now being affected. 3 is ulceration, less than 1/3. 3B is more than 1/3 is affected. From S you can learn corneal scar, and F is fundus is also being affected. Till 1B it is reversible. That means if you give vitamin A in higher doses, these white rod spots are also reversible. What is the richest source of vitamin A? It is halibut fish. Now this is very important, very important. Vitamin A doses. In less than 6 months you give 50,000 international units. 6 to 12 months 1 lakh, and more than 12 months it is 2 lakhs. Total we give it from 6 months to 5 years. Total 9 doses are given, and if you will calculate it will come at 17 lakh international units are given. Very important. Total 9 doses, 17 lakh international units. Less than 6 months it is 50,000, 6 to 12 1 lakh, and more than 12 months 2 lakhs. So how one will give this in an Anganwadi? How to calculate 1 lakh or 2 lakh? You give it by the spoon. So if you see the spoon, in reality there are 2 markings, a small curve and a big curve. Small, it is 1 ml and it is 2 ml. 1 ml is around 1 lakh international units, and 2 ml it is around 2 lakh international units. You learn it like that. Now vitamin E, very important. Vitamin E, also known as tocopherol, tocoretinol. It acts as an antioxidant. Means why it is acting as an antioxidant? Because it is protecting the RBC from any free radical injury. It mimics vitamin B12 deficiency, very important. It is also mimicking Friedreich's ataxia. Friedreich's ataxia, you all know, GAA. Friedreich's ataxia, which chromosome is affected? You tell me. There is clinical features: hemolytic anemia, acanthocytes, and demyelination of posterior columns. Decreased proprioception and vibration sensations are present. Very important. Ataxia, posterior columns are affected, means same decreased proprioception and vibration sensation. It mimics B12 deficiency, but what is not present? Hypersegmented neutrophils are not present. And there is risk of enterocolitis in infants with excess of vitamin E. This is, I've included this, it is showing acanthocytes. So now if you rule out vitamin D12 deficiency can be the answer if it was not written the blood smear is negative for megaloblastic segments or hypersegmented neutrophils. Vitamin K cannot be the answer because no any hemolytic, if there was be vitamin K deficiency, the history would be of some bleeding or hemolytic disease of newborn. Nothing is given. Vitamin A, white rod spots or some night blindness, something would have been given. Vitamin E, that is the B is the answer. Why B? Because it is mimicking vitamin B12 deficiency. There is no megaloblastic anemia, no hypersegmented neutrophils. So answer is E. Vitamin B, vitamin E deficiency is the answer. Cystic fibrosis, autosomal recessive disorder, chromosome number 7, phenylalanine, and it is the loss of fat soluble vitamins. Chloride channels are affected. Pale conjunctiva tells us about anemia is present in the patient. We check for anemia clinical, we check in the lower palpebral conjunctiva. So that is why it is saying pale conjunctiva. Thank you guys. See you tomorrow with another question. Thank you.